Hello dear students, welcome to my channel. So today I have selected a defense mechanism or mental mechanisms as a topic for our discussion. So this is very important topic. We can expect one or two questions from this topic. It is very important. So all of you note down and listen carefully this topic. Okay. So defense mechanism is also known as mental mechanisms. So defense mechanisms term is coined by Sigmund Freud. Okay. And what is this defense mechanisms? Defense mechanism is nothing but these are the mechanisms which involves in protecting the self-respect and avoiding anxiety and stress. Okay. So these are the certain strategies which will help in protecting the self-respect and preventing the occurrence of anxiety and stress. Okay. So these defense mechanisms are classified into positive defense mechanism and negative defense mechanisms. Okay. So positive defense mechanisms are those which are beneficial to the users and prevent them from developing a mental disorders. Negative defense mechanisms are those which are not beneficial to the persons or users, and such frequent use of this defense mechanism can lead to development of mental disorders. Okay. So first we will discuss about the positive mental mechanisms. Okay, for positive defense mechanisms, and next we will discuss about the negative defense mechanism. So first one, positive defense mechanisms, that is the rationalization. Okay. So this rationalization, it is a defense mechanisms which involves protecting the self-respect. Okay, whenever there is a threat to the self-respect, it tries to protect the self-respect by giving certain rationals or reason for unacceptable acceptable behavior, and thereby preventing the development of anxiety or stress. Okay, for example, if a person fails in examinations, okay, he will not tell that he was not studied well and for the reason he has failed in the examination. Instead of that, he will give some certain reasons or rationals. Okay, certain reasons. So for example, he may tell that there is no proper electricity in the hostel, or the question paper is very tough. Okay, so such rationals or reasons he will give, and he protect his self-respect and prevent the occurrence of anxiety or stress. Okay, so this is known as a rationalization. Okay, unconsciously he give a reason or rationals for his unacceptable behavior. Okay, he never accept the exact truth for his unacceptable behavior. Okay, so that is nothing but a rationalization. Next one is a compensation. Compensation is another defense mechanisms. Okay, this whenever a person is having a shortcome or a weakness in certain areas, he tried to compensate that one with another strength available in his own capacity. Okay, for example, a person who is not good in studies, okay, he may find some other strength in his ability, like a sports or some cultural activity, and he will work more on that one and try to achieve something in that one, and thereby he makes up his deficiency with something achieving in a other than the studies. Okay, for he will achieve good in the sports or culture, and thereby he protect his self-respect. Okay, or a person who is not handsome, who is not beautiful, so he will try to make a good in studies and try to compensate that deficiency. Okay, so that is nothing but a compensation. Next one is substitutions. Substitution means whenever a person is unable to meet his goals or desires, so he will find some other substitutes and satisfy with the getting of other substitute. For example, a student who is aspirant of medical seats. Okay, a person who is preparing for MBBS, if he is not able to get a medical seat because of deficiency of score, if his score is less, so in that condition, what he does or what she does here, whether whenever there is availability of any dental seat or any nursing seat, so he will be happy with the getting such another alternative seats. Okay, so this is known as substitutions. Okay, so when a person is unable to achieve such goals and desires, he will just alternatives available will be he will be happy with getting alternatives. Okay, next one is repression. Okay, so this repression is unconsciously forgetting the stressful or anxiety producing situation. Okay, again it is unconscious mechanisms. Whenever a person faces anxiety producing or stress producing situations, okay, after facing that one, unconsciously he will forget that situations. Okay, unconsciously it happen. For example, a child who is caught during the stealing some money or things. Okay, so later the child unconsciously forget the situations and come up from that one. Okay, that is a repression. Okay, next one is sublimation. Sublimation is nothing but the frustration or anxiety of someone. Okay, he will channelize into socially acceptable manner. Okay, for example, a person who is frustrated or become angry on someone, he may channelize his frustration on like a hitting onto the boxing, punching on the boxing this one, and thereby whatever frustration he will channelize in an acceptable manner. Okay, does not harm to the person who has made him to angry or frustration. Okay, so the or example, for example, whenever the person is having any frustration or angry on the someone, he will write it in his diary and try to channelize in the try to get rid of frustrations in writing something and relieve himself. Okay, so this is known as sublimation. Okay, next one is undoing. Undoing is again a positive defense mechanisms in which sometimes a person hurts someone feelings. Okay, so after hurting someone feelings, he will feel guilt. Okay, after feeling guilt, what happens, he try to make up his guilt. Okay, so by helping that person again or presenting certain gift or giving some treat to that hurted persons, so after giving the some gift or a treat, so he feel good and his guilt will go off. Okay, so this is known as undoing. Undoing is nothing but so he will intentionally or unintentionally he will hurt someone, and after hurting someone he feel guilt. Okay, so how to get rid of this guilt? Okay, again he goes to the such persons and try to help him or giving some presenting some gift or giving some treat or helping some other way. So we try to make up that guilt. Okay, try to get rid of that guilt by helping such person. Okay, so that's nothing but undoing. Next one is intellectualization. So intellectualization means what happen, the person will whenever something wrong happens to the person. Okay, someone if someone met with an accident. Okay, so he will completely detach from that one, and he will explain, he will use an intellectual component. Okay, and try to forget that situation. Okay, for example, a person who is diagnosed with a terminal illness, he will keep on studying about that disease conditions. Okay, and he will try to become mastery in studying that condition and try to forget that he is having that terminal illness. Okay, he maintains a distance from the fact that he is having a terminal illness. So this is nothing but a intellectualization. So these are all about the positive defense mechanisms. Now let us come to the negative defense mechanisms. In that one, first one is suppression. Suppression is nothing but a deliberately separating or forgetting the unpleasant or anxiety producing situation. Okay, so deliberately the person will try to forget or suppress the unpleasant or anxiety producing situation. For example, parents who have lost their child, or parents who come to know that their child is having a terminal illness, so they deliberately forget, they deliberately suppress that information and try to avoid that situation. That is nothing but a suppressions. Next one is a displacement. Okay, so this displacement is nothing but it is a mechanism, defense mechanisms, which involves shifting the this frustration on some other persons who is less threatening. Okay, for example, a person who get blames or shouting from his boss, and he becomes frustrated. So that frustration he will channelize into someone like his wife or his children. Okay, because he cannot express the frustration on the boss because there is a threat of losing the job. So because of this, he will show the frustration and angry on his wife or children who is less threatening. Okay, so that is nothing but a displacement. Next one is a projection. So projection is nothing but a person try to, it is a defense mechanisms in which a person own fault, okay, is been blamed to other. Okay, for example, a person who is unable to do some certain things, he may blames others, that because of others are not properly helping him, because of that only he is unable to do the things proper. Okay, for example, a surgeon who is doing a surgery, he may blames nursing staff for his own fault. Okay, so he may be doing the fault in surgery, and nurses may be properly assisting him, but he will blame nurses because of his fault. So this defense mechanism is known as a projection. Okay, and next one is a reaction formation. Reaction formation, it is a again a defense mechanism or mental mechanisms in which person will exhibit exactly opposite behavior or opposite feelings, express opposite feelings than what he feel exactly. Okay, for example, a person who is having who dislikes someone may treat very friendly and very well he will treat. Okay, so he may not be, the person may not be liking such persons, but when he meet such person, he will show that he is very much interested and very much liking that person. Okay, so the person will have exactly opposite emotions. Inside he will be having a negative emotions, and outside he may express a positive emotions about the persons or a situation. Okay, so that is nothing but a reaction formation. Next one is a regression. So regression is another defense mechanisms in which whenever a person faces an anxiety producing situations or stressful situations, person will go back to his previous life. Okay, and he try to be in that situations. Okay, so he may go into the his childhood state. There will fixate himself. Okay, for example, whenever a person faces an anxiety or a stressful situation, he try to suck his thumb or try to bite the nails. Okay, so he'll go back to the his previous stage, childhood stage, and adopt those mental mechanisms. Okay, so that is nothing but a regression. Okay, regression is going back to the previous life and fixing into that one whenever a person faces an anxiety or a stressful situation. Okay, next one is the dissociation. Okay, so this dissociation is another mental mechanisms in which whenever a person faces an anxiety producing situation, stressful situation, he dissociate himself. Okay, and forget about that situations temporarily. Okay, for example, suddenly person will become, when he faces an anxiety producing situation or panic situations, okay, he will dissociate, he will forget about his surroundings and dissociate himself and forget everything about the surroundings. Okay, so that is nothing but a dissociation. Okay, next one is conversion. Conversion means this psychological conflict or stress or anxiety is turned into physical symptoms. Okay, so whenever a person is a state of stress or this one psychological conflicts, that will turn to physical symptoms. For example, a person who is going for writing in an examination today, he may develop a migraines. Okay, because of examination causes anxiety or stress. So that anxiety and stress are turned into physical symptoms like a migraine headache. Okay, so when psychological stress or conflicts are turned into physical symptoms, that is known as conversion. Okay, next one is withdrawal. Withdrawal means a person will withdraw from exposure to the situations where there is a anxiety or stress will occur. For example, a student who fails in examination may withdraw coming out of the home, so that he may feel that his self-respect will be harmed. Okay, so that is nothing but a withdrawal. Okay, so person will avoid contacting with the people because his self-respect will be affected. Okay, so that is nothing but a withdrawal. Next one is a denial. Denial is deliberately avoiding the truth or the fact which is fact. Okay, for example, a person who is diagnosed with the like a terminal illness, he may avoid going to the hospital or the doctor. Okay, and he think that he's all right and nothing is happened to him, and the diagnosis made by the doctor or hospital in the hospital, it is wrong. Okay, he deliberately avoid the truth or the fact. Okay, so these are all the defense mechanisms. Okay, positive and negative defense mechanisms. So in the examination, they may give a statement. Okay, and they will ask for which defense mechanism the person is using. Okay, so they may give a cite an example, and they will give options of these all defense mechanisms, and you have to find the right answer, which defense mechanism the person is using. Okay, so this is most important defense mechanisms. So all of you have to read one or twice or thrice. Okay, and become familiarized with these defense mechanisms, so that you will get at least 1 or 2 marks in examination. Okay, so thank you very much. So I wish Makar Sankranti to all of you. Okay, enjoy your life as well as concentrate, okay, on your studies. Okay, focus to your studies so that you should get crack examination. Okay, thank you all.